In this video, I'm going to talk about Section 3 of the Qualification Specification. This is the section that contains a lot more of the subject-specific information. I'll be covering the content of each of the two units, and we'll discuss what your learners are expected to know to enable them to achieve each of the learning outcomes. Unit 1 is an introduction to body systems and principles of training in health and fitness. It provides learners with a lot of the underpinning knowledge and understanding required for health and fitness, including the structure and function of key body systems, the effect of health and fitness activities on the body, and the components and principles of fitness and training. The guided learning hours, or GLH, for this unit are 48 hours, and the unit weighting is 40%. As there are only 2 units, this means the second unit has a weighting of 60%. It's also important to note that Unit 1 is externally assessed. There are 4 learning outcomes, or LOs, in this unit. LO1, understand the structure and function of body systems and how they apply to health and fitness. LO2, understand the effects of health and fitness activities on the body. LO3, understand health and fitness and the components of fitness. And LO4, understand the principles of training. I will take you through each of these LOs and outline what you should teach your learners to equip them with the best chance of achieving. In the first learning outcome, your learners will need to develop knowledge and understanding of the structure and function of different systems in the body and how they apply to health and fitness. We start with the structure of the skeleton. Your learners will be expected to know and understand the bones as they are divided into the axial, appendicular sections of the skeleton. Next, your learners will be expected to know and understand the key functions of the skeletal system, these being support, movement, protection of vital organs, storage of minerals, blood cell production, and shape. Learners will be expected to know and understand the 5 types of bones: flat, short, long, sesamoid, and irregular, and the examples of each as stated in the specification. So, for example, short bones should include carpals and tarsals. For types of joints, your learners will be expected to know the definition of a joint and the 3 different types of joints: fixed, slightly movable, and synovial. For fixed joints, they will be expected to know and give examples as per the Qual specification, such as skull and pelvis, and also, for slightly movable joints, the spine. For synovial joints, learners will be expected to know the different types, those being pivot, condyloid, saddle, gliding, ball and socket, and hinge joints, with the examples as stated in the qualification specification. These assessment criteria are also linked to the joint actions criteria, in that learners will be expected to know and link the ball and socket and hinge joints to joint actions. For example, the learner will be expected to know the joint actions linked to a hinge joint, such as flexion and extension. Or, for the ball and socket joint, this could be all 5 of the joint actions mentioned in the specification: flexion, extension, rotation, adduction, and abduction. We don't expect learners to know the specific named ligaments and tendons. They just need to be able to label the ligaments and tendons of the knee synovial joint diagram. For the structure of the spine and posture, learners will be expected to know and understand the 5 different regions of the spine: cervical, thoracic, lumbar, sacrum, and the coccyx, otherwise known as the tailbone. It's important to note that the learner is not expected to know the number of vertebrae in each region. Moving on to posture, learners should understand the importance of posture when performing health and fitness activities. For example, in health and fitness, good posture helps with performance, as special positions are often crucial to success, such as our position throughout the squat or deadlift. Finally, the learner should understand and recognize the different postural changes, such as kyphosis, lordosis, and scoliosis. LO1 also covers the muscular system. Learners need to know the three different types of muscles: smooth, cardiac, and skeletal. For the structure of muscular system, your learners should be able to locate all of the main muscles of the muscular system. The full list of muscles that learners are expected to locate are outlined in the specification. Learners must know about muscle movement and contraction in the form of agonist and antagonist pairs, and be able to apply this principle through specific health and fitness movements. For muscle fiber types, learners need to know and understand the differences between and the characteristics of slow and fast twitch fibers, how they are suited to different types of activities, how they vary in individuals, and how they are affected by specific training. Learners will need to know and understand the structure of the respiratory system, including the pathway of air through the respiratory system. Learners will need to understand the various functions of the respiratory system, which include the role of intercostal muscles, ribs, and diaphragm in breathing, including both breathing in and breathing out. Gas exchange, diffusion, movement of oxygen and carbon dioxide between the lungs, blood, and alveoli, and the features of alveoli that assist gas exchange. Learners will need to know and understand tidal and residual volume and vital capacity, and the changes within these lung volumes from rest to participating in health and fitness activities. Moving on to the cardiovascular system, when it comes to the structure and function of blood vessels, learners will need to know and understand veins, arteries, and capillaries, and how the structure of these blood vessels relates to functions of blood distribution. For example, veins have valves to ensure blood flows in one direction. In addition, learners will also need to understand vascular shunt and how blood vessels change to support blood redistribution. For example, widening of blood vessels, vasodilation, and the narrowing of blood vessels, vasoconstriction. Learners need to understand the structure of the heart. More specifically, they must be able to locate structures of the heart by labeling a diagram. We have kept this labeling to a minimum so that learners only need to be able to label the structure of the heart to identify atria, left and right, ventricles, left and right, pulmonary vein, pulmonary artery, aorta, and vena cava. Learners will need to know the cardiac cycle, that being the flow of oxygenated and deoxygenated blood. Learners will also need to understand cardiovascular measurements, such as maximal heart rate and cardiac output, and know the relationship between stroke volume, heart, and cardiac output. It is important to understand that learners may be asked in the exam to recall the equation for cardiac output of maximal heart rate, but will not be required to calculate it from any examples. Learners will understand the two different types of blood pressure, systolic and diastolic, the ranges of blood pressure classification, and the factors that can affect blood pressure, such as diet, age, and stress, for example. Learners will need to understand the anaerobic and aerobic energy systems and how they apply to health and fitness activities. For the second learning outcome, learners will be expected to know the short and long-term effects of health and fitness activities, but also understand why the short or long-term effects occur. For example, while they may be able to recall a short-term effect such as breathing rate, they need to understand why this increases as a short-term effect of exercise. They would need to explain that the respiratory system detects changes in carbon dioxide and oxygen in the blood, and therefore increases the rate of breathing to provide ample supplies of oxygen in the blood to cope with the demands of exercise. In Learning Outcome 3, learners will need to understand the terms health and fitness, both independently and in relation to each other. For components of fitness, learners must understand how they are categorized as either health or skill-related, and understand how each component is linked to health and fitness activities. Additionally, they need to understand the effect that improvements to each component can have on the performance in the activity. Learners will need to be able to define the 5 health-related components and the 6 skill-related components of fitness as identified in the Qualification specification. Learners should be able to link each fitness component to health and fitness activities. So, for an example, muscular endurance is a health-related component and it can be linked to the health and fitness activity of press-ups. Learners will need to understand that improvements made to muscular endurance could improve the number of press-ups done in a minute and thus improve their muscular endurance in relation to their performance during press-ups. So to summarize, learners need to be able to define each component of fitness, understand which are health-related and which are skill-related, be able to link them to health and fitness activity examples, and understand how improvements to each component of fitness will affect performance in an activity. The final learning outcome of Unit 1 is understanding the principles of training. This has been included to ensure learners have the knowledge and understanding necessary to plan a successful training program. They will cover the principles of training using the SPORT acronym: specificity, progression, overload, reversibility, tedium, and also the FIT principles: frequency, intensity, time, type. Learners must understand how these can be applied to health and fitness activities. For example, the second component in sport is progression. If you're lifting the same weight or running the same distance each week, how are you ever going to improve? In order for a training program to be successful, it must apply the principle of progression, meaning that you must be consistently looking to improve your results. Progression can occur in many forms, such as adding more weight, more repetitions, more distance, faster speed, or less rest. However you do it, progression is about achieving better results every time you go out on the track or in the gym. We've now covered all of the learning outcomes for Unit 1. Remember, Unit 1 is externally assessed, and you can find more information on this on the website. In Unit 2, learners will learn how to prepare and plan a health and fitness program. This includes understanding the impact of lifestyle, setting goals, and understanding how to test and develop components of fitness. They will learn how to structure a program and how to prepare safely for health and fitness activities. The guided learning hours for this unit are 72 hours, and the unit weighting is 60%. The result of the external assessment for Unit 1 is weighted at 40% and makes up the remainder of the overall grade. Unit 2 is internally assessed by means of a synoptic project. There are 4 learning outcomes in this unit. LO1, understand the impact of lifestyle on health and fitness. LO2, understand how to test and develop components of fitness. LO3, understand how to apply health and fitness analysis and set goals. LO4, understand the structure of a health and fitness program and how to prepare safely. I will take you through each of these LOs and outline what you should teach your learners to equip them with the best chance of achieving. In this first learning outcome, learners will develop knowledge and understanding of the impact of lifestyles and how they affect health and fitness. With activity levels, learners must know and understand the terms active lifestyle and sedentary lifestyle, and understand recommended guidelines from the NHS for active lifestyles. They should be able to provide examples of moderate and vigorous activities for health and fitness. When it comes to diet, learners will need to know and understand key nutrients and balanced diet guidelines, but also how to recommend changes to a diet to support a healthy lifestyle, such as portion size or eating habits. For rest and recovery, learners must know and understand the importance of rest and recovery for health and fitness, including rest pertaining to sleep, recovery between activity sessions, and recovery between repetitions. The other factors that learners need to know and understand are how other lifestyle factors can have a negative effect on health and fitness, and this includes drugs, smoking, alcohol, and stress. We've had a few questions on the drugs element of this learning criteria, and when we say in the specification recreational and performance-enhancing drugs, we are not concerned with specific drug examples, but more the effects they can both have on health and fitness. For the second learning outcome, learners are required to develop an understanding of how to test and develop components of fitness and apply it to health and fitness activities. Learners will know and understand how to prepare and undertake an appropriate and recognized test for each component of fitness, health-related and skill-related. They will then need to know how to collect data from the tests and how to use and analyze it to evaluate levels of fitness. This includes using normative data and testing and retesting of component of fitness tests. While delivery of this will be best served through initial teacher input and then practical participation of component of fitness tests, it may not be accessible or appropriate to conduct them all, as long as the knowledge and theory is covered. Resources and time may restrict your ability to conduct all components, but you should certainly try to practically cover a good range. Learners will understand different training methods as stipulated in the qualification specification and understand how they can support individual goals through a health and fitness program. To optimize a health and fitness program, learners should first understand the heart rate training zones for aerobic and anaerobic fitness, the heart rate ranges of both, and how they could support individual goals through a health and fitness program. Secondly, in order to design a health and fitness training program, learners should understand reps and sets for power, muscular strength, and muscular endurance. For learning outcome 3, learners will develop an understanding about lifestyle analysis and its application to specific health and fitness goals. Learners are expected to know and understand about health and fitness analysis tools, including PAR-Q, Physical Activity Readiness Questionnaire, Lifestyle Questionnaire, Food Diary, and Client Progress Review. With each of these analysis tools, they will understand what information they would collect, how to administer them, and why they are used. Learners must understand the acronym SMART in relation to goal setting. They must be able to apply SMART principles to set goals based on health and fitness analysis data and to support designing and developing a health and fitness training program. This fourth and final learning outcome of Unit 2 is designed to give the learner the knowledge and understanding to design and develop a health and fitness program. We expect that the program will be the culmination of many aspects covered in earlier learning outcomes, such as goal setting, SMART targets, and training principles, etc. Learners will develop knowledge on what to include on a session card, main activities, health and safety, and understand warm-ups and cool-downs. Essentially, they develop all of their knowledge and understanding up to this point to aid them in developing a training session card. We've now covered all of the learning outcomes for both units. I hope you found this helpful. If you have any questions or would like further information, feel free to contact our curriculum team, customer support school team, or qualification advisory team using the details on screen. Thank you for watching this video.